My name is Merlin Ray McLean. I go by Ray. I'm a native born and raised in Arizona. I am 55. I am the proud father of 5 beautiful children.
Well, I'm a primary care physician here in the Phoenix area. I do direct medicine at this point in time. Direct medicine is the new term for concierge type medicine. About 12 to 15% of adult Americans in their lifetime have some problem with alcohol dependence. Programs such as Start Fresh is a completely innovative way of treating this problem. The process begins when a patient initiates a phone call and realizes that they have a problem in the first place.
Up until January 14th of last year, I would have considered myself a normal drinker.
My name is Dr. Kathy O'Connell. I'm a clinical psychologist. I'm originally from Louisiana, but I've been in Arizona since 1976. With Start Fresh, I'm doing psychological evaluations before they have the pellet implantations. It's really common to do pre-surgical psychological evaluations for a lot of different procedures. We want to make sure that we have patients in the best position possible to benefit from the procedures they're about to undergo.
When somebody walks into my office, I want to get a good feeling of who that patient is. I want to get a good history from everybody. I want to know what kind of medical problems they have, what kind of medications they're taking.
Preston was my baby, and now he's playing Army. And they use real bullets, I'm told.
After we get, a feeling from them about their history, then we obviously want to do a pretty thorough physical exam. Pending all those results, we're able to see those patients back in a short time for the naltrexone implant.
The anxiety raised to epic levels. I turned to alcohol to medicate myself, and it worked.
Naltrexone is an opioid antagonist. And basically what that's doing is it's blocking opioid receptors in your brain.
I just can't get past the craving. And I know if I could get past the craving, I can stop.
Opioid receptors are responsible for the cravings, the excitement that people experience, not only with opioids, but also with alcohol.
Made a doctor's appointment the next day. Tuesday, I had my physical exam. Thursday, I had my pellet.
It works almost immediately. Most of these patients already have no cravings within the first day.
I felt the effects of medication immediately.
This is a great program. I think this effectiveness of this program has not been seen previously.
Start Fresh gave me hope the very first day I got my implant.
The 85% effective rate, you don't hear of these numbers with other treatment programs.
One of the things I think that makes the Start Fresh program different from others is its feasibility. You can continue with your life and still participate fully in the Start Fresh program.
The beauty of Start Fresh recovery alcohol program here in Arizona is that this is an outpatient procedure. This involves no inpatient time.
Tuesday, I had my physical exam. Thursday, I had my pellet. That was at 9 o'clock in the morning. I was back at work at 10.
Many of these patients come over their lunch hour. They're back to work that afternoon. It's non-disruptive to their lifestyle. It's non-disruptive to their life.
Start Fresh is helping people not only get free of the alcohol, but maintain their relationships with their families, maintain their employment, and maintain their overall lifestyle.
For them to be able to carry on their own lives, at work, at home, socially, unbeatable.
We're not just implanting a pellet and then letting them go on their own.
It's very important that our patients also get life coaching.
My name is Terry Liddell. I'm a drug and alcohol counselor, and I am currently working with Start Fresh Southwest as their director for the life coaching program.
Life coaching involves a telephone or a Skype conference and multiple conferences to continue the process of sobriety for these patients.
I got sober. Part of the recovery journey is to give back.
Terry, my life coach, is now helping me with the habit side of it.
There is a possibility of change. We can be different. If I can do it, anybody can do it. It's so powerful with the Start Fresh, with the naltrexone implant, because it's like the cravings stop. At that moment, then we can start talking to the person. We can start dealing with the behaviors, the belief systems that are really the negative things that cause them to continue to drink and use.
What he's taught me is to go down a different road.
When I saw this, it just blew me away.
Start Fresh is teaching me that I don't have to be an alcoholic, and it does not have to control me, and it does not have to be cunning and deceiving.
It's the first time I've ever seen a medical process and a psychologically healthy process come together in one place.
It's a painless procedure. It's extremely effective. You can't beat this kind of a program.
If I could do it, having the addictive type of personality that I have, you can do it.
Absolutely, I would advise people to try the Start Fresh program.
If I was to give you advice about Start Fresh, if you had a problem with alcohol, the first thing I would tell you is pick up the phone and call them.
I'm very happy to have the Start Fresh alcohol recovery program in Arizona. It offers an option that simply hasn't been available here before.
What do you got to lose?
If you really want to stop, this is one of the best ways. It's simple, it's convenient, it's quick.
No further conversation. You need to do this.
Here's a way to stop this in a hurry. And I mean in a hurry. I get to watch miracles happen on a pretty consistent basis.
The most tender moment that I've had in my life was with my wife. When she looked at me and said, "Welcome home. I've missed you for a long time." When she said that to me, all hope for sanity, for quality of life began. Life's great. Start Fresh of Arizona saved my life and my marriage.